When we think about infectious diseases, there are so many examples. But what if I told you in 2015, 257 million people were living with this chronic condition and almost 900,000 people die each year? You would probably want to know what it is. This condition is the most common liver disease in the world, called hepatitis B, and it is caused by hepatitis B virus. So today we discuss about what is hepatitis B virus. It is a small DNA virus that infects the liver, means it mainly chooses liver cells or hepatocytes as their host cell, and it causes a highly contagious liver infection. So next is the structure of hepatitis B virus. It is a small but very well equipped virus because this virus not only contains genetic material and protein capsid, but it also contains its own enzymes which helps them to start replication and doing work the moment when it enters the host cell. So this is how it looks like. It is a spherical virus first of all, double shelled, structure of about 42 nanometer in diameter. We can see in the next figure, it consists of a lipid envelope containing HBs antigens that surrounds an inner nucleocapsid composed of hepatitis B core antigen. It has a complex structure with virally encoded polymerase and the viral DNA genome. So next is what disease it causes. It causes a life-threatening hepatitis B liver infection and can also cause chronic infection and put people at higher risk of death from cirrhosis and liver cancer. The term cirrhosis is an end-stage liver disease, and it's a condition of the liver in which normal functioning tissue is replaced with scar tissues, and regenerative nodules are formed as a result of chronic liver disease. In terms of transmission, hepatitis B is primarily spread from mother to child at birth, sexually transmitted, or misuse of contaminated needles. It can also be transmitted by the exchange of infected body fluids such as blood or saliva. Most people do not experience any symptoms when newly infected. However, some people experience acute illness with symptoms that last several weeks, including yellowing of the skin and eyes, also known as jaundice, dark urine, extreme fatigue, nausea, vomiting, abdominal pain. Acute hepatitis B versus chronic hepatitis B. Acute hepatitis B is a short-term illness occur within 6 months. A small subset of individuals with acute hepatitis B can also develop acute liver failure which can lead to death. On the other hand, chronic liver infection that lasts for 6 months or longer. In some people, the hepatitis B can cause a chronic liver failure that can later develop into cirrhosis, also known as scarring of the liver or liver cancer. And this form of chronic hepatitis B is known to have much worse outcomes than the acute hepatitis B. In terms of prevention, safe and effective vaccines that offers to 98 to 100% protection against hepatitis B is available. The World Health Organization recommends that all infants receive the hepatitis B vaccine within 24 hours after birth. Dose is an effective measure to reduce transmission from mother to child, but remember it's just a preventive measure. As of today, there is no specific cure for acute hepatitis B. Therefore, care is aimed at maintaining nutritional balance, replacing lost fluids from vomiting and diarrhea. Chronic hepatitis B can be treated with medicines including oral antiviral agents. Treatment can slow the progression of cirrhosis, reduce incidence of liver cancer, and improve long-term survival. How to prevent hepatitis B? The best way to prevent hepatitis B is to get the vaccine and recommend it for people who live with someone who has HPV, children and adolescents not vaccinated at birth, anyone who has STIs including HIV, people who inject drugs and share needles and syringes, healthcare workers and medical officers. If you think you have been in contact with the hepatitis B virus, see your healthcare provider right away. Stay safe and thanks for watching.